I want to welcome you to today's webinar on alcohol, equity, and social justice. We're calling it Breaking the Silence, and it's an honor to have you all join us as we embark on this important journey of exploration and advocacy. Alcohol consumption is deeply ingrained in many cultures around the world, often symbolizing celebration, relaxation, and social connection. However, behind the facade lies a complex web of inequities, injustices, and disparities that profoundly impact individuals and communities. Today, we shine a spotlight, recognizing that alcohol-related harms are not distributed evenly across society. Instead, they are disproportionately affecting marginalized and vulnerable populations, exacerbating existing disparities, and perpetuating cycles of disadvantage. Through this webinar, we aim to initiate a candid and constructive dialogue about the ways in which alcohol intersects with issues of equity and social justice. And we will explore the root causes of alcohol-related inequities, systematic barriers that perpetuate these disparities, and we'll discuss strategies, most importantly, for fostering greater equity and inclusivity in alcohol-related policies and interventions. I encourage you to actively engage in today's discussion, share your insights and your perspectives, and join us in our collective effort to promote equity, justice, and well-being for all. Together, we can break the silence and pave the way toward a more equitable and just society. So I thank you once again for joining us today, and let us begin our journey toward a positive change. This is our acknowledgments, and I want to make it clear to you in these acknowledgments that the opinions expressed herein are the view of the PTTC network and do not reflect the official position of the Department of Health and Human Services, DHHS, or SAMHSA. No official support or endorsement of DHHS or SAMHSA for these opinions that you will hear described in this document are intended or should be inferred. You will be provided a copy of the slide deck, and you'll have these acknowledgments for you to read over yourselves. Our learning objectives for today are here on the screen. We're going to explain how inequities are infused in the history of alcohol. We'll describe to you the health inequities and contributions to alcohol-related harms. We'll describe how the alcohol industry itself perpetuates and supports inequity. And we'll examine evidence-based alcohol policies that alleviate inequity and address social justice issues. And most of all, I want you to consider the role of ATOD-focused communities and coalitions and how they can support the development of equitable policies. This is our roadmap for today. This 2-hour presentation we have planned for you today will start by introducing the speakers. We'll provide an overview of the webinar, focus on the intersections of alcohol, equity, and social justice. We'll jump into the historical context of alcohol use and its connection to systems of oppression. We'll examine the role of marketing and advertising in perpetuating alcohol-related disparities, and we'll highlight effective policies and interventions aimed at addressing alcohol-related inequities. We'll explore practical steps and actionable strategies for advancing equity and social justice. And in the end, we'll have an evaluation for you. So we want everyone to make sure you stay to the end, because in that evaluation, it's where we get the feedback that we need so we can continue to provide you quality programs. But throughout the webinar, we'll engage in discussions, we'll share insights and perspectives, and collectively explore ways to break the silence surrounding alcohol-related inequities and work towards a more just and equitable society. During the webinar, I want to ensure you that you experience as smooth and seamless as possible. Our dedicated staff members, who you see pictured here, LaShonda Williamson Jennings, myself, Derek Newby, and Wanda Hudson, who you see pictured here, are here to assist you throughout the session. You can chat with us if you have any questions, and if you have any challenges, then you can let us know as well. But we are your South-Southwest PTTC support staff. We're the team. If you have any questions related to technical issues, or if you encounter any technical difficulties, or if you even need assistance with anything related to the webinar, Lori Smith and Richard Feinberg are here to assist you as well. So please don't hesitate to reach out to us, your team at South-Southwest PTTC, using the chat feature. And we're all standing by to provide you support and assistance to ensure that you get the most out of today's webinar. Your satisfaction and engagement are our priority. So with that said, we will be assisted today. Also, you have a co-facilitator who is Michael Sparks. Michael Sparks is an alcohol policy specialist and president of Sparks Initiative. His primary interest is in assisting communities to implement evidence-based environmental strategies to reduce alcohol and other drug problems. Among others, Michael is currently working with the Wake Forest University and St. Joseph's Healthcare Foundation and Health Foundation of South Florida on a range of public health issues. He currently serves as the co-chair for the Scientific Advisory Board of the U.S. Alcohol Policy Alliance. And he is also here to help you today. Now he will introduce our lead facilitator for the day.
Yeah, thanks. Thanks, Derek. First, let me thank LaShonda, Derek, and Wanda for having the courage to take this session on and put this out there. This is hard work, and I like to think of this session as not the outcome of, but part of the process we started 2 years ago at the Alcohol Policy 19 conference in Washington, D.C., where we had a 2-day workshop with over 100 people who were focused on alcohol policy work, of really being to question our own values and beliefs as it relates to why aren't we talking more about social justice and equity in our policy work? Why aren't we doing this? You know, we are principally a white field of policy workers, and it was time to have our own reckoning. And this work, this things that Dave are going to talk about, and the subsequent policy work that focuses on the importance of working in disproportionately impacted communities around policies is part of our long-term transition as a field. And this, I'm very grateful to hear today to introduce David. Dave and I go back to 1988, and where we started working on alcohol policy together. And we've known each other for years, worked on many, many projects together. David's the professor and assistant dean for practice at the BU, the Boston University School of Public Health. But mostly what David is a researcher and a practitioner, that rare individual who both looks at the science, writes about the science, publishes article in the science, while at the same time takes that and translates the research into the practice in communities, and is an expert on so many different aspects of the alcohol field, including how we do policy, that I'm honored to have him here talking about this today. So with that, let me turn it over to you, David, and you can go ahead and go to the next slide with who you are.
Thank you so much, and thanks to the PTTC for having me. As Jimmy Carter used to say, that's the nicest introduction I've had recently. So a little more about who I am. You've heard sort of the official stuff, but personally, first let me say I saw in the names coming in on the chat a Sydney Jernigan, and I'm very pleased that I have a distant relative on this webinar whom I'm sure I've never met. But I am a son of a Methodist minister and a public health nurse, and I ended up somewhere in the middle. I was raised in the Protestant tradition of social justice and doing the right thing. My father taught at the theological seminary that Martin Luther King had just graduated from, and I was steeped in the post-World War II social gospel, that whole Christianity as doing social justice thing. I don't have much of a personal alcohol story. We had little or no alcohol at home. I am a parent and a grandparent, but as you hear me, I'm much more of a geek. And so in our coalition work, I don't usually play the parent and grandparent role. There are other people who look and sound more like that than I do. I play the research geek. And I will say I am in all this because of my personal story, not about alcohol, but about what my parents taught me to do, which was to speak truth to power and to seek to do the right thing. What I want to do today is end up with encouraging you to think about a new alcohol story, because the story we're living with today is a pack of lies. I'm inspired by Harold Johnson, who was a part Cree attorney in Canada, who wrote the book Firewater, How Alcohol's Killing My People and Yours. And what Harold Johnson says in that book is we have to take back the alcohol story. What is today's alcohol story? It ignores much of history. And when it pays any attention to history, it tells lies about history. It covers over history. I've been inspired recently by a relatively new book called Smashing the Liquor Machine by a historian at Villanova by the name of Mark Schrad, who just does an amazing book in 500 fine print pages of retelling the global story of the fight against the alcohol industry in the 19th and early 20th century. Today's alcohol story is primarily being told to us by a handful of giant and highly profitable transnational corporations. And the story they tell is a story about individuals, individual drinkers, individual people with a problem. They don't tell a wider social story. Their story normalizes alcohol. Michael may remember there's a slide we used to use that I can't find anymore, but it was a picture of those of us who are old enough, they used to deliver milk in these wire-rimmed things with the 6 bottles. And the ad was of the morning paper on the doorstep and one of those things containing 6 bottles of Chardonnay. And the tagline was, finally a Chardonnay for every day. They normalize alcohol, and we need to tell a very different alcohol story. Because as George Santayana so memorably said, those who cannot remember the past are condemned to repeat it. I think we can do better. So I'm going to take us way back. I'm going to take us back to the beginning, to what we know about the history of alcohol. Beverage alcohol, it's been present in nearly every society. I'm trained as a sociologist. Emil Durkheim is one of the 3 big sort of figures in sociology. And he famously said, if you have laws, then you have a society. Well, one of the first laws that every group of humans has had to figure out is how to handle intoxicants. Wine and beer have been present for at least 5,000 years. Distilled spirits first show up in human records somewhere around the 12th century AD. There are a few exceptions. There are a few parts of the world that never had alcohol: Oceania, the north of Mexico, and the remainder of North America prior to the European contacts. This historical challenge of alcohol to societies has been, as I said, how to handle it. And many societies have historically treated it as special, as for particular times of the year, etc. But what quickly happens with alcohol over and over again is the privileged learn how to manipulate the alcohol supply to maintain dominance. And I'm going to tell you some of those stories. I will tell you today, I'm only going to scratch the surface. There are many, many stories to be told here. But what I mainly want to do is to unveil the covert violence of oppression supported by alcohol. So let me start with something that will be familiar to most of us, I think, which is the slave trade. And the slave trade was a triangle. It was rum from New England to the African continent, traded for humans, forcibly brought to the Americas to cultivate and harvest sugar, brought to New England to make rum. Absolutely essential to the slave trade. Now, let me shift to the British Empire itself. And I should say, numerous empires have been built on alcohol. The historian who wrote that book, Smashing the Liquor Machine, his first book was called Vodka Politics, and it was a history of the Russian Empire, where 40% of the income from that, of the funds supporting that empire, came from alcohol taxes on the peasantry. So what did the British do? They were amazing. And this is a quote. I did a bunch of research in Malaysia in the 1990s. And one of the spokespeople for Customs and Excise Malaysia told me, the British gave opium to the Chinese and alcohol to the Indians. And that's Indian subcontinent Indians. We're familiar with the Opium Wars. We're much less familiar with how the British used alcohol as an instrument of subjugation and dominance in the Indian subcontinent. I lived in Singapore and did a bunch of research in Malaysia. And when the British controlled what was then called Malaya, they systematically manipulated the palm wine supply to control plantation workers in Malaya. In the Indian subcontinent itself, they controlled and manipulated the toddy supply, again, to control the workforce and the population. Let's flip over to Southern Africa, where there is just a fascinating set of documents that historians have delved into, correspondence among the mine owners in sub-Saharan Africa, particularly in the tip of Southern Africa, around how strong they should make the alcohol in order to keep the workers addicted enough that they'd stay in the mines and not go back to their villages, but not so addicted that they couldn't work. So that's Southern Africa. That's another part of British influence. And here you just see pictured the drunken Indian, in this case, again, Indian subcontinent stereotype. The drunkard consumes his money and drink and leaves his wife and children to starve. Again, no mention of how this was serving the interests of the empire itself. A long history here of blaming the drinker rather than looking at the structure of the supply, the nature of the product itself, and how it works for subjugation and dominance. We're in a period where there's widespread struggle, I think, to understand the role that anti-Semitism plays, that Jewish oppression plays. And I like to throw in this piece about Jewish oppression because in the 18th and 19th centuries in particular, in Northern Europe, Jews were forbidden from cultivating the land, from doing all sorts of things that would give them an economic role in society. They were very limited in what they were allowed to do. And one of the things that they did in Northern Europe was the nobles gave the Jews the exclusive right to sell alcohol. Now, those tax collections, as I said about the Russian Empire, they were absolutely critical to the livelihood of the nobles. So they set the Jews up to be in that middle agent position where the Jews had to make their livelihood off of alcohol and were under huge pressure from the nobles to sell a lot of it and to tax it. If the peasantry got upset about that, they would then blame the Jews rather than the nobles who were ultimately profiting from it. Let's move to this continent. Again, this is one of the few places in the world where alcohol was not present before the arrival of the Europeans, so there were no cultural or biogenetic protections against alcohol for indigenous people on this continent. And the colonizers used this as an instrument of dominance. The guy who trained me and mentored me in this field, a guy named Jim Mosier, he's an attorney, and one of the first projects he did was he traced the development of laws passed by the colonizers to control the native population on this continent. And what he found over and over again is, as the so-called frontier moved westward, the first laws that were passed to control the indigenous population were the alcohol laws. Alcohol was the excuse introduced by the colonizers, like they introduced lots of other things like blankets with smallpox, but introduced by the colonizers and then used as an excuse by the colonizers to begin to pass laws controlling the indigenous population. If I fast forward in this country, in the United States, I'll come to this again a bit later, but we have the phenomenon of redlining. And redlining was a practice in the 30s, 40s, and 50s by the federal government in the US, defining certain neighborhoods as okay for investment. And, you know, not subtly at all, basically controlling where banks would put their investment money, with the red areas being the worst, the yellow areas next worst, and the blue next, and then the green. And this is just a map, and you can see these in city after city across the US. Those little dots are the alcohol outlets. And you can see part of the legacy of the structural racism of redlining is the over-concentration of alcohol outlets in poor and minoritized communities. The example here being Oakland, California. Now, this is what I would call a form of violence. And I want to break down violence a little bit for you because I want to talk about overt and covert. So at the personal level, overt violence are things like aggravated assault, sexual assault, but covert violence, you know, the stuff that you don't see, you don't hear about, but boy, does it have effects on people, are things like extreme neglect, abandonment of children, all that. We shift over to the institutional side, the overt violence of slavery and of mass incarceration. That's more obvious. Covert violence, though, are things like the structural redlining of entire communities and populations, and as I'll talk later in the presentation, oppressive marketing.
David, this is
Yeah.
I just want to check in with you because the slide a moment ago where you showed Oakland and the redlining in Oakland and the overconcentration of outlets in that city. How, from your perspective, having worked, you know, in many communities across the country, how prominent is this, if it's not direct redlining, but this really, and I know you'll talk more about this, but the overconcentration of outlets? Because I think it's easy for many of us to say, well, that's not going on in my community. I'm not Oakland, I'm not Baltimore, I'm not in a big city. But I think this plays out in other smaller communities that may be less obvious. Do you have any thoughts on that?
Sure, let me break it into two, okay? First, let's talk about overconcentration. And here we have national studies that have been done. And what those studies have found is over and over and over again, despite the fact that Black and Latin people drink less, despite the fact that poor people drink less, alcohol outlets over and over again are overconcentrated in neighborhoods where those are the majority populations. This has been a phenomenon, I say, that many of my colleagues have studied, but then some of my colleagues and some of my students have tried to understand this phenomenon. Where did it come from? And one of my students, I'm a co-author on it, she looked at this for Baltimore City, and she looked at all the possible factors, and there's ways we can do this with statistical methods. The single factor with the greatest explanatory power for the overconcentration of outlets in poor communities in Baltimore City was a history of redlining. There's a group in California that looked at multiple cities across California, reached the same conclusion. So we haven't done it for every city in the country, and different things happen to these communities. You know, in some places, so-called urban renewal and the miracle of the interstate highway system meant that these communities were actually blasted out of existence, literally. So you won't see that same pattern in quite the same way because the communities were destroyed. But in an awful lot of cities, this is what we continue to see.
Yeah, that's sorry, go ahead.
Go ahead. No, go ahead.
No, I would say that's helpful. And I know we'll talk more about this, but I think it's really important to recognize that the redlining that you're describing and the overconcentration of outlets is in Oakland and other cities is also true in poor white communities as well. We have higher concentrations of outlet where we have economic deprivation. So we frequently hear folks saying from rural communities, well, you know, this doesn't really apply to us. You know, we're primarily a white community. I said, well, where are your outlets concentrated? You know, because this is a process they use to exploit communities of color as well as poor white communities as well. And the other thing I really want to point out is that while there may be more outlets, those outlets in these overconcentrated areas are frequently selling and operating in ways that are more problematic than in wealthier and white neighborhoods. And so when we get into some of this deeper into the session, I really want to sort of point and bring to the front that the operational practices contribute to the violence that you were talking about as is overt and covert violence that we're discussing here. So my point in raising this is we all need to be looking at this. You don't have to live in an inner city to sort of think about the implications of the industry's role in moving alcohol in oppressive ways across the country.
And there's one more aspect I want to point to, which is what perpetuates this and is often talked about is the NIMBY phenomenon, not in my backyard. And communities with more resources, you know, being able to use the political process to keep outlets out of their neighborhoods. But I think it's really important to note that this wasn't just people neighborhood by neighborhood doing this. This was an official policy of the United States government. And if you haven't read or seen the book Color of Race, it's just an incredible book that talks about policies like this that set up poor and minoritized communities for many of the issues that we see today. All right, so that's violence. What does this mean in terms of health? So these are two big numbers, and they are conservative. We're about to, I think, March 1st, I think CDC is going to release the latest estimate of how many people die per year from alcohol, and it's going to be substantially larger than 140,000 at least. That's what my CDC contact told me. That 249 billion figure, that the last time we did one of those studies was in 2010. Obviously, that even that money would be worth a whole lot more now. Alcohol consumption is rising in the US. It bumped up during the COVID pandemic. We're anticipating it'll crest down slightly, but the general trend in this century has been for alcohol consumption to rise. And as people drink more heavily, and we have more problems. And I want to talk specifically just about a couple. One is sexual assault, and this is just really tricky to talk about. And I think the best way to word it is that alcohol is the substance most frequently used to facilitate sexual assault. And the fact that perpetrator and victim are more likely to have been drinking does not remove the nature of the phenomenon, which is this is the substance most frequently used to facilitate sexual assault. But I want to also talk about a range of other problems caused by alcohol use. And I'm using the word cause very intentionally here. You'll see on the left-hand side of the box of this slide, those numbers are what we call alcohol attributable fractions. So my my colleagues, the alcohol epidemiologists, come up with these fractions by looking at tens, if not hundreds of studies, doing meta-analyses where they throw together all the data and subject it to statistical analysis and come out with these fractions that they conclude are the percentage of these that would not have happened or that only happened because alcohol was in the picture. That is, where alcohol was the causal factor. So if your communities are looking at homicide as an issue and you're not talking about alcohol, you're missing 47% of the problem. If there's concern about suicide and you're not talking about alcohol, you're missing close to a quarter of what's causing the bump up in suicides in our population. Now, in terms of alcohol and violence, it is important to note that this relationship is bidirectional, okay? That alcohol consumption leads to violence. That's one direction. And the way it does this is both biologically and sociologically, that biologically, alcohol is a disinhibitor in our brains. It removes some of the inhibitions that would otherwise keep us from doing certain things, but it is also the great social alibi. I was blacked out, I didn't know what I was doing, etc. So that is alcohol consumption's role in leading to violence, but when you drink, you're also much more vulnerable to experiencing violence. And again, this is not to blame the victim, but this is to point out that this is a bidirectional relationship, that people who are drinking are more likely, are more vulnerable to experience violence.
David, before we go on
Yeah.
to the next slide, I have a request to sort of open up a little bit of discussion at this point. And Derek, I don't know if you want to have this through a chat, but we're interested in knowing and have you comment and think about your communities, where you work, where you live, and what's the relationship that your community has with alcohol. You know, do you have a lot of outlets? Are the norms particularly favorable? Is there alcohol-related violence, overt alcohol-related violence occurring? What are you all seeing? Because we want to now have you stop and pause and think about where you do your work and where you live in terms of some of the kinds of issues that David's been talking about here, both in terms of the redlining, the overconcentration, the kinds of problems that are related to overconcentration of outlets in terms of violence. What are you seeing? And Derek, you can do this either way you want. You can bring people off screen or you can just use the chat.
Put the answer in chat so everyone can reply, but if you have something specific that you'd like to say and you're unable to chat, then you're free to open your mic at this time and answer the question.
We're all working at the community level.
Yeah. Let me just add, while we're waiting for folks to write or open their mics, what I usually say about alcohol and violence is any situation where there's a possibility of violence, if you add alcohol to it, it's like throwing gasoline on a lit fire.
Excellent point, Dave.
So we're seeing some chat comments. Alcohol use abuse is correlated with unemployment. Folks see domestic violence. Coors, oh yeah, it's starting to flow in now. Coors and Pendleton Whiskey sponsor our largest event.
Wow.
Muck Stampede Rodeo Suicide Race. Yes, it's called the Suicide Race. So Stacy, if you're up for it, would you be willing to say a little more about that? That's pretty shocking, that event, and how that sort of came to pass, if you know, and what it looks like in terms of the sort of the availability in alcohol and the kinds of issues that may arise at the event itself.
Hi everyone. Yes. So the suicide race has been, oh gosh, at least 40 years, and it started with the Colville Indian Reservation, and And then they joined with the city of Omak to have it also be a rodeo. And so it is a second Tuesday of August, second weekend in August every year. And we are a small community of maybe 5,000 people, and we maybe get that weekend 20,000 people that come in. It's a large, it's not a fairground, but there's a large camping site, a large stadium, and Pendleton Whiskey and Coors sponsor the event. There's a beer garden. Our coalition worked with the Stampede to try and make sure young people didn't get access. So I will give them credit for that. But advertising goes up. Other alcohol, so like Budweiser will come in and try to compete with Coors because they know that they have extra advertising. So they will try to put up, one year Budweiser put up like 5-foot tall like boxes attached to the fuel where you get gas up for fuel as try to compete. So that happens. And law enforcement, they try to mitigate by bringing other law enforcement agencies in. There's stabbings, there's sexual assault. Those type of things happen all the time, every year. The emergency room gets overrun, alcohol poisoning. So yeah, that happens, and we're in a small community.
Right, right. Yeah. So a good example of the way in which violence plays out and the normalization of alcohol through events, which a number of people are commenting on, and how alcohol becomes ingrained into the culture. I saw a lot of comments about the fact that the sort of the community norms around alcohol, that it's available everywhere. It's in all facets of the community. It's in everybody's lives. It's in the home environment. It's in the public environment. There's lots of outlets. There's redlining. We're seeing all of that. So I think part of opening that up was just to give you a moment to think before we move into the next section about how this kind of these things that David are pointing out are showing up in your own communities in different ways. David, I don't know if you have any comments before you move on.
Michael will be shocked that I have a few things to say.
Yes.
So first, I want to take on the boredom piece. And I got to say, I'm always deeply skeptical of it because even in places where there are quote unquote lots of other things to do, people are drinking a lot. And I want to hark back to the temperance movement in the 19th century and to things like libraries and cinemas and a lot of these things that we see as institutions in our communities now. They were started as alcohol-free alternatives. And it is possible to have an interesting and fun life without alcohol. I love when people bring up culture because, again, I've spent part of my career studying alcohol marketing. And one of the things that marketing is the intentional creation of culture. That's what the marketers are doing. They are trying to produce and reproduce cultures of drinking. There's a great, Michael knows I love Broadway musicals, and I won't sing this, but there's an amazing Rodgers and Hammerstein song about racism, where the main line in it is, "You've got to be carefully taught." And we have been carefully taught about how to use alcohol, where to use alcohol, when to use alcohol. Billions of dollars a year are being spent to carefully teach us this. So let me go a little bit into some of the ramifications of this. I'm going to talk some about the disparities. And again, I could spend hours talking about this. I'm going to go through it fairly quickly. But the first thing to remember is that Black and African American and Hispanic and Latino people drink less than white people. They're young people, drink less than white young people. American Indian and Alaska Native, that's the names that the federal government gives them in the surveys. So those are what these data are from. They binge and drink heavily at close to the same rates as white people. But all these groups experience much higher levels of negative consequences from alcohol use than white people. And if I just get a little bit specific, we're doing more and more work these days on cancer. Alcohol is recognized as a causal factor in 7 cancer sites in the body. And cancer has both higher prevalence and higher mortality in Black and African American as opposed to white individuals. The same is true for liver disease, and that one's true for American Indian and Alaska Native folks as well. For alcohol dependence, that's also true of Latino folks. For alcohol-related motor vehicle deaths, true of both of the other groups as well, and intimate partner violence. And again, lots and lots of studies have shown this, and I so appreciate my colleagues in public health who do this epidemiologic research. But it's really important to me to be able to share it with you, because this doesn't get talked about, or it doesn't get talked about as much as it could. If we move beyond the deaths, injuries, and illnesses to social consequences, and here we're talking about things like arguments or fights with a spouse or with people with whom you live, or injuries, a workplace, legal, etc., problems as a result of drinking. Even among those who report little or no heavy drinking, African American and Latino adults are more likely to be at risk for this whole range of social consequences than white adults. So just to recap here, lower income, indigenous people, and people of color are less likely to drink than white people and suffer higher levels of harm. And what I always say is the same amount of alcohol in a lower income family, community, or country, because we see this globally as well, will cause far more damage than in a wealthier setting. If you think about it, in a setting with more resources, there's more things to catch somebody, there's greater access to healthcare, but we have an awful lot of high functioning heavy drinkers in corner offices. And yet the stereotype is that this is what happens with poor people. That's where it's visible. That's not the place where it's happening the most. Did you want to break in there, Michael?
Can you hear me okay, David? I
Yep.
shifted microphones. Okay, good. Yeah, I think the question here for us, once again, those of us who are working on the ground, is in our communities, what are we looking for? How do we begin to understand this relationship between white communities, individuals drinking more, but lower income communities drinking less and having greater consequences? I mean, when you were talking about that, what came to my mind was the notion that the number of people, when I used to work in treatment, the number of people who just bought their way into 30-day treatment programs, while folks with less income or who were basically on 6-month waiting lists to get into state subsidized, residential care or treatment programs. And so, even in our own field, this is something that we see. But so what do we look for? How do we begin to understand these inequities in our day-to-day work in our communities, whether we work in communities of color, racially diverse communities, low income, primarily white communities? What do we go out and look at? What do we think? How do we think about this? Because I think it's hugely important. And I think as a field, we're trying to understand the implications it has for us as both prevention workers who do programming, but also prevention workers who do policy. How do we think about it?
It reminds me a little bit of the early days of the HIV epidemic, when people would die, wealthier people, not gay identified people would die of a long illness. And that's what we have with alcohol, is we have people dying of a long illness who are from more resourced communities, celebrities, etc., whatever. whereas it just shows more. And this comes down to also, how do we tell the alcohol story? What's the alcohol story that we're telling? So let me just breeze forward a bit. I want to now bring you back to a little bit of a history in order for us to really understand what we're facing today, because alcohol transitioned in the last half of the 20th century. And again, this is something I've studied globally. There was a huge change in the alcohol supply, in particular, a move from traditional and local forms of supply to global and corporate forms of supply. And here in the US, the absolute game changer was when the cigarette company Philip Morris bought Miller Brewing in the 1970s. The story that's told in the unauthorized biography of the Anheuser-Busch dynasty, which of course I've read, is that when that happened, Philip Morris brought everything they'd learned about how to market tobacco to alcohol, including sports sponsorship. In response, Anheuser-Busch III, then president of Anheuser-Busch, took the book of the 6,000 sports events happening in North America, threw it across the table at his marketing people, and said, buy this. At one point, they were sponsoring everything from tiddlywinks to 23 of the 24 Major League Baseball teams at the time. So what does this mean for us today? It means that when we take this on, we are taking on a $1.8 trillion industry worldwide. It's highly concentrated in terms of ownership, and the 9 biggest companies, this was my estimate from like 5 years ago. At that point, they were the 55th largest economy in the world. I just redid this for the 10 largest. They're the 24th largest economy in the world. In 2019, this was the 8th most profitable industry in the world. Slightly less profitable than tobacco, but more profitable than soda pop. These profits are from drinking that the industry says over and over again they do not want. Consumption of alcohol is heavily skewed in that the heaviest drinkers drink the bulk of the alcohol. They also come from underage drinking, and this is a study that my group did. We used a unique survey that we've done. We've done a national survey of young people's consumption of alcohol by brand, and we were able to create the alcohol market of young people, and as a result, be able to estimate that in 2016, people under 21 consumed about 8.6% of the alcohol drunk. About 1 in 11 drinks consumed were drunk by underage people. And this translated into $17.5 billion in sales for alcohol companies, with the 3 biggest companies getting almost the majority of those sales: Anheuser-Busch InBev, Miller Coors, and Diageo, which is the world's largest drink maker. Now, this plays an intimate role. This concentration and high level of profitability plays a key role in what we see every day from the alcohol industry. This is an industry that is completely dependent on its marketing. Again, I interviewed alcohol industry executives all over the world. The head of the CEO of the largest beer company in Southeast Asia actually said to me, a beer is a beer is a beer. People drink the marketing. What marketing does from an economic perspective for this industry is it puts up what economists call a significant barrier to entry. That is, it keeps other firms from being able to compete. If you want to be a small brewer or be a small distiller, I mean, the craft people are running into this over and over again. You cannot compete unless you link up with one of the giants. This concentration of ownership generates what we call oligopoly profits, which in turn support more marketing spend. And the marketing spend, it keeps those barriers to entry in place and also counters the increasingly bad health news about alcohol. Now, there's one other form of marketing that we need to mention here, which is what we call stakeholder marketing. You might call this lobbying. Stakeholder marketing in 2021, the alcohol industry spent $30 million on lobbying just at the federal level. For that, they had at least 282 registered lobbyists. That's more than one lobbyist for every 2 members of Congress, what I call a very good teacher-to-student ratio. And then at the state level, it's about $15 million a year passed out to state legislators. So that's what we're up against. This is the situation. Today's alcohol marketers tell the majority of the alcohol stories. And this is key to their role in oppression. And what's the story they're telling? Well, it's a story that is absolutely laced with tropes that reinforce sexism, racism, that are about cultural appropriation, that lie about the effects and that blame the victim. And let me just walk you through a few examples. And again, Michael knows we've produced whole slideshows about each one of these. But let's talk about sexism. This woman is on her knees, adjusting her lipstick, using her boyfriend's belt buckle as a mirror. I'm going to let you use your imagination. This is a product I'm not sure the world needed, whipped cream vodka. You've heard about the relationship between alcohol and violence. She is clothed only in whipped cream, and the tagline is, "Been whipped lately." This is a responsibility ad from the industry, and here you see something that you'll see over and over again, which is, what's the product here? Is it designated driver? No, it's me. In advertising targeted raised male people in particular, the woman is the product. You drink the product and you get her, and of course, she's dressed in the Budweiser colors. Pink washing, there's no safe level of alcohol consumption for breast cancer, and yet Mike's Hard Lemonade wears a pink ribbon. This is an amazing ad. Oh my gosh, he looks so wonderful. He's so cuddly. He loves puppies, and he drinks Molson. That's what was in the women's magazines. And in the men's magazines was hundreds of thousands of women pre-programmed for your convenience. As you read this, women across America are reading something very different. An advertisement, figure 1, scientifically formulated to enhance their perception of men who drink Molson. This ad was played during the Oscars a while back, and I think it speaks for itself.
David,
She
can we
has-
get some feedback on that before you go to your next slide?
Sure, go ahead.
Well, I'm just wondering, how are people responding to that ad? It's just anyone who feels like it can come off and mute and sort of give us
I was waiting for what alcohol it was going to be. Like, normally I feel like I can spot it pretty early. And in that one, I was like, okay, I'm not seeing any labels or logos, and the satin kind of gave a hint, but it was odd that it was so clearly not about the alcohol, but is all about the alcohol.
And what I'm wondering, when I see those ads, I get offended at the exploitation. I'm just kind of wondering sort of viscerally how you respond to seeing this. Dina, you had your hand up?
Gina, you're on mute.
Okay, there we go. So I hate to get political, but if the government keeps taking away women's rights, we're going to see more and more of this. That's just my view.
Okay.
I mean, I mean, a lot of people may not agree, but I think it kind of goes hand in hand. The less rights we have, the more sexism we're going to see.
Thank you. Other comments?
And Yale
Just
said
to
it was
continue, I'm sorry. Just to continue where she was going, though, women as property is nothing new. And this is just kind of an extension of that.
Mhm.
And a reinforcement, she has no identity. Those women have no identity. They are all exactly the same. That's what strikes me.
Other comments?
I think it's interesting that, a lot of people that are knowledgeable about marketing and sexism and alcohol, we can clearly see how that ad is inappropriate. But there are still even a lot of women that won't understand the sexism related to that. They'll probably comment and say, "Oh, those women were so beautiful. They did so great at dancing." But even women sometimes don't quite notice that sexism and that targeting.
David's showing examples here of ads that may be in magazines or on TV. Part of our work now is deconstructing the whole advertising promotion environment in the outlets that are in our stores itself. And so it may not be as blatant, or it may be as blatant, but one of the places we intersect with this kind of intentionality of the industry to frame the story and objectify women, for example, is in the advertising that our kids see when they walk into some of these locations. And so this is part of our work is to sort of look at our environments. When we talk about all of us being responsible for doing environmental strategies, we're really talking about those settings where these kinds of behaviors and this kind of intentionality for the industry plays out. What does the advertising look like? How dense are the outlets? What are we seeing happening around those settings? So go ahead, David. I'm going off on a
Two additional points, I guess. And one is what Jerry's pointed out in the chat. The Distilled Spirits Council of the U.S. until 1996 had in their voluntary marketing code that they would not advertise on television. They quietly changed them in 1996. They made a deal with NBC in 2000 to start putting ads on, and there was outcry from Congress and others, including the brewers. And they pulled back on that deal, but they then went to cable. And you've seen the proliferation of streaming TV, forms of TV, etc., and at the same time, distilled spirits advertising. Just when we first started tracking this in 2001, there were 1,900 ads. By 2009, there were 61,000 ads for distilled spirits on U.S. television. So that's one point I wanted to make, and I've already forgotten the other one. So let's move on. Oh, I know what it was. Yeah, I refer to this stuff, the metaphor I use for this is wallpaper. You walk into a room and it's got really ugly wallpaper and something's bothering you. But after a couple of minutes, you just stop noticing it. And we have to let this stuff bother us because my position on it is the wallpaper that we've allowed to be there. All right, racism. This is what the industry did in the 50s. Obviously racist tropes. This is what they were doing in the 80s, using tropes like civilized in advertising, targeting the Black community. This is more recent. Over and over again, you see colorism in the ads. He's darker, the women are lighter skinned. There was always he's, him, and then multiple women. And then this is a much more recent ad, nothing real heavy, not even the conversation. The implication being you can't have a conversation between white male adults and African heritage male adults without getting heavy, without having alcohol. So then the expropriation and the racist marketing using heroes of indigenous peoples, naming products after them. This is a product, Crazy Horse malt liquor, came on the market and indigenous people actually protested it and it was pulled from the market. But again, this is part of the wallpaper we face, and it leads into this whole area of cultural appropriation. You really see this among Latin populations. Cinco de Mayo, a holiday created by Chicano activists to promote Chicano pride, and now appropriated from alcohol companies. Drink like a patron, tipsy from Cinco, for Cinco, and one company even renamed it Drinko de Mayo. Going to move on to blaming the victims, and this is the classic rhetoric that you get from the industry. It's a mistake to blame the product for alcohol abuse. Individual drinkers are responsible for their behavior. That was in the Philip Morris CEO's briefing book for his shareholder meeting. And then again, as long as the public continues to view any consumption of alcohol and abusive use of alcohol as two different subjects, the majority of the anti-alcohol agenda will not be met with much success. The bottom line here, the only problem is those people who abuse our product. Other than that, it's all fine. And please don't talk about breast cancer or other things where there's no safe level of consumption. Fetal alcohol spectrum disorders. This is the industry funded something called the International Center on Alcohol Policies in Washington, D.C. It was then succeeded by something called the International Alliance for Responsible Drinking. They're both front groups funded by the biggest alcohol companies. But FASD, many people feel there's insufficient evidence regarding moderate consumption of alcohol during pregnancy and the effect it may have on a developing fetus. They're not necessarily a causal relationship. Other maternal risk factors, in other words, blame the victim, include drinking alone, family members who abuse alcohol, having less stable domestic partnerships, and being at risk for domestic violence. Not our product, your fault. Philip Morris again, too many domestic abusers use alcohol as an excuse not to change. Alcohol does not cause the battery any more than stress, illness, or being out of control does. Domestic violence, they tell us, is a learned and chosen behavior intended to control an intimate partner. This is the industry's version of the alcohol story. We have no responsibility for it. All the responsibility lies with the user, lies with the communities. And we take this to the community level. I'm going to come back to those issues we talked about the outlets, because what we know from the research is violent crime increases when neighbors have a high density of places that sell or serve alcohol. So many studies of this. When the number of alcohol outlets increase, so do problems, violence and crime, sexually transmitted infections, noise, injuries, property damage, and so on. And again, studies that we did in Baltimore, a group of colleagues found that as of 2010, each additional alcohol outlet in a census tract would predict, if it was an on-premise outlet, a 3.1% increase in violent crime in that census tract. If it was an off-premise outlet like a liquor store, a 4.8% increase in violent crime. And yet we hear over and over again, we need more alcohol outlet licenses. We need to promote our downtowns. This is a pro-business policy. And there's no health in that conversation. I did a study of this in my home state of Massachusetts and found in the first place, Massachusetts is famous for Dunkin' Donuts. We have more places to buy alcohol in Massachusetts than we have Dunkin' Donuts. Never enters the conversation, and there's never a health impact assessment. What's that initial outlet going to cost us, going to cost a community in terms of police costs, hospital costs, et cetera? Specific things that outlets do. operating hours, and I'll talk about this more in a minute, but basically CDC concluded any change 2 hours or more in one direction or another would have predictable effects on crime, violence, etc., in the vicinity of that outlet. Other studies have looked at single servings and the risks that those cause. We did another study, yet another study. I was in Baltimore for 10 years. We did a lot of studies there. Knowing that greater concentration of outlets was associated with more violence, we then looked at one aspect of the outlets, which is how much advertising could you see from the street, from that outlets? You know, these outlets, a lot of them, they plaster the windows with giant posters for the product. And sure enough, what we found is that neighborhood by neighborhood in Baltimore City, even when we adjusted for the overconcentration of alcohol outlets, the amount of advertising visible from the street, the retail advertising, was associated with higher levels of violence in those neighborhoods. And then we'll come back to redlining, because this is the structural heritage. This again is Baltimore, but we could do it in any number of communities. I was a faculty member at Johns Hopkins University. Roland Park is a neighborhood where a lot of the faculty live. It's 82% white. Its median income at the time, $104,000 a year, had 2.7 liquor stores per 10,000 people. Greenmount East, where my school was actually located, 97% Black, median income $23,000 a year, 7.3 liquor stores per 10,000 people. So almost 3 times as many liquor stores. So what can we do about this? We've done a lot of work on the powers available to cities, and there are 3 specific ways that cities can address this. No matter how much they may be preempted at the state level from doing this, many cities have licensing authority that they share with their state or that they have even without the state. Beyond that, they have the ability to do city planning, to use zoning laws, and we pioneered this in literally dozens of communities in California in the 80s and 90s. And then every city has nuisance powers. And if you can demonstrate that the outlet is a nuisance, the city has the ability to take action leading up to actually shutting it down. Can this work? Can this do anything?
David, hold on.
Yeah.
We just put a
Go
chat
ahead.
question in.
Yep.
Yeah,
Yep.
we got a chat question in for you all
Sure.
to think a little bit about where you live and the kinds of structural policy related tools you might have or have. We'll talk some about successes in a minute, but just what can, when you think about your community, what comes to mind in terms of some of the possibilities you might be able to use in terms of policy work to begin to address some of these inequities, some of these density issues, product issues? And part of what David was talking about is what we call the 4 Ps. The place where the business is located, overconcentrated in poor communities. What are the products that they sell? Do the products that they sell in one part of the census tract or one census tract different? We know that's true, that the product mix in a low income or community of color is a very different product mix than in a higher income community. What about advertising? Is there more advertising or different types of advertising that exist in one part of your community versus the other? And what about the price of the product itself? Place, price, product, and promotion. Those 4 Ps create the alcohol environment. And so just what are you seeing in your own communities? And what tools have you begun to think about as a way to address some of these issues? This really gets us from the conceptual idea of, okay, we understand that this is going on. Now we want to push you a little bit in thinking about what can you do about it? What can cities do? What's your coalition do?
And Michael, one of the first steps that cities need to take, that coalitions need to take, is to actually make it visible.
Yep.
To do a scan of what the environment looks like in a lower income or minoritized community and compare it to a largely white, higher income community. It's only that photographic evidence that sometimes gets city councils, whatever governing bodies, to start to take action, because otherwise it is like wallpaper.
It is paper. You know, we have a comment here about New York, that some states, in this case, we're talking about New York, have what we call high preemption, where the state controls and maintains the authority to use licensing, and in some case prevents localities from using their zoning laws to rebalance the distribution of outlets across the community. But one place where even high preemption states, ones who really don't want the localities mucking in the industry's influence, and so they control the levers of land use and zoning and licensing, is in nuisance powers. Cities frequently, even cities that are preempted from using zoning to determine how many and where outlets can be located, can use their nuisance powers to address the problems that these businesses create. And so, you know, you may have heard, and frequently you will hear, if you talk to a city attorney or you talk to legislators, say, there's nothing we can do about this. This is all the ABC. You know, they control all this stuff. And that's just disassociated from the fact that there are local powers that communities have to address aspects of the 4 Ps. Nuisance powers address the consequences associated with overconcentration. And if used properly, you can close outlets down. You can, while you may not be able to regulate the content of advertising because of you know, just the constitutional amendment issues, you can often regulate how much advertising of all types is visible in a liquor store. California, for example, has a law where no more than 33% of the window space can be dedicated to any advertising. So there's ways to get through this, and we will talk a little bit about some success stories in a few minutes. But while we're going through where, you know, some of this, be thinking about your own community. And David, you probably have other comments you'd like to make.
No, I thought that was good. I just think I want to move on, Michael.
Oh, all right, let's do it.
So we do have evidence that when we do this, it has an effect. And this is the one published US study about this. This was in a relatively high income neighborhood in Atlanta, where an intentional 3% reduction in the number of alcohol outlets was associated with a twice as great a reduction in exposure to violent crime in that neighborhood than in 2 other comparable neighborhoods. The study I love to talk about here was in a city of about 450,000 people in Brazil, where they had initially had alcohol sales allowed 24 hours a day. They moved it back to an 11 p.m. Cutoff. And over the course of a year, they cut the homicide rate in half. We have a brand new study that will be out April 1st, where we've looked at a similar thing that happened in Baltimore City. And I can't show it here because it's not published yet, but I can tell you we got very similar results. So the question in the chat, it's on the slide. The 2 other neighborhoods that were compared were Midtown and Downtown. So the bottom line here is there are things that we can do. And my career has been devoted to what I call the 3 A's. Dealing with affordability, and that's about influencing price and tax. And, you know, I do everything I can to support tax campaigns, not only in the US. I'm just back from a meeting in Mexico City where we have teams in 6 countries who are trying to raise alcohol taxes in their countries. Affordability, attractiveness, and that's setting limits on the alcohol advertising and promotion, and availability, and that's reducing the alcohol outlet density. And we have really, really solid research, and frankly have had for years. The research base just gets stronger and stronger. I and my colleagues do more and more studies. We fill in the gaps, etc. But the bottom line here is that what we know works in alcohol is rarely done. Michael, you're on mute.
Sorry. There's a question in the chat box now about, you know, put some of your success stories in there trying to address some of these structural structural issues related to availability of alcohol. And while folks are typing, Dave, I want to ask you, why is it rarely done? And certainly it starts with alcohol policy is political, but you also noted earlier in your presentation that we have a $1.8 trillion industry that we're bumping up against. But from your perspective, having worked all across the country, why do our coalitions tend to some of them shy away from this kind of work, the really addressing the availability of alcohol in the retail environment and its consequences?
Well, I hate to say it, but I think far too many of us have bought the industry story. That this is about individuals, this is about improving services, this is about, we're caring people. We don't want people to keep suffering. I don't want people to keep suffering. But we will never treat our way out of this problem. So that's part of why it doesn't happen. It took me years to figure this out, but alcohol consumption rises with income and with education. And I finally realized that alcohol is the drug of choice of the people who write the laws. At this point, we're not in that situation with tobacco. We're certainly not in that situation with heroin or cocaine or whatever. This is overwhelmingly the drug of choice of the people who write the laws. And so we come to them with this, and they see themselves in the policies. They see this inconveniencing them. That is a major barrier to us. The bigger picture here for me is, again, what I said at the beginning, just how much we've been lied to about alcohol. We've been told a story about temperance and prohibition that is a completely false story. So much of what was happening in temperance and prohibition was trying to undo the big alcohol of that time, trying to undo the saloons that were controlled by the big producers. If you go back to the Russian Empire, the peasant revolts, again, Mark Schrad in his book tells stories over and over again. Struggles over alcohol were struggles of the oppressed against the oppressor. But that's not the story we tell. We hear a story about somebody like Carrie Nation. And you think of her and you think, oh, this wacky woman with an axe. And I'm sorry, Carrie Nation was a huge fighter against racism. She donated her speaking fees over and over again to organizations working in the Black communities. She was a fighter for women's suffrage. She was a progressive and she was a fighter. And it's a great line in the Mark Schrad book. She was the epitome of, I'm going to get the line slightly wrong, but I think you'll know what I'm talking about. Women who don't make trouble don't make history. Mm-hmm. She was a woman who made trouble.
I want to add to the story, and we who take federal money, BFC, Projects for Success, those who are funded through dollars either directly from the federal government or subvented down to the communities, often are told nonprofits can't lobby. Nonprofits not only can lobby and do political work, it should be in their DNA to do that kind of work. And the fact that we have been restricted, this is my personal opinion, and actually this is an opinion where someone shared with me once when we were talking about the way in which the government has restricted the use of their dollars for alcohol. By the way, you can use federal money to lobby for tobacco policy. Anyone who works in tobacco knows, because master settlement, it's around alcohol, we can't use those dollars. And so we're told you can't use those dollars. Industry gets really upset if they get a sense that somebody's using those money to work on a local policy. They make it known, they may get sued or whatever that is. That's, as my one colleague and friend said, it's just another form of industry influencing and creating oppression in communities where they can't fight back. And
Uh,
so, nonprofits can lobby. We need to do the work that's on this slide, and we can.
I want to jump onto Dina's comment in the chat as well, that we need to educate, educate, educate. I absolutely agree with that, but the people we need to be educating are the policymakers. I'm doing a training this weekend here in Massachusetts for high school students. And we got the head of the committee in the state legislature who has most influence over alcohol to agree to have his committee briefed by young people from across the state. And so I am going to train those young people about how to brief the committee members. I love working with young people. I love treating young people as citizens, not as vessels to be filled with information, but as minds who can share their perspective of the world and powerfully educate our policymakers. So, Michael, I think I need to proceed.
Yep, keep moving. We got about 10 more minutes.
Okay, so I am so inspired by Frederick Douglass, who was another great champion of temperance, who said the price of liberty is eternal vigilance. Our voices matter. The alcohol companies have literally wallpapered our lives with their version of this alcohol story, that alcohol is everywhere and belongs there, that everyone drinks, which is not true, that drinking is equivalent to freedom, independence, and success. And the industry wants us to believe that this is not about a system and a product with a legacy and a present that feeds injustice and misery, that this is all about individual people with an individual problem. So, James Baldwin, not everything that is faced can be changed, but nothing can be changed until it is faced. So what do we need to face here? Basically, just all those things that I just said to you, and the basic punchline of this whole presentation, we have to take back that alcohol story. So what's the different story we need to tell? Of children growing up free from the pressure to drink, of Black, Indigenous, and people of color and women being respected, of individuals not being blamed for the actions of a hugely profitable industry, of poor communities and communities of color not being flooded with alcohol outlets and associated violence, and of alcohol prices that reflect the real cost of alcohol and don't just function to make a rich industry richer. Our voices matter so much. You and what you do are people who inspire me. This is the image I always have in my head. We are the little fish. And when we come together, we can be victorious over that big fish. We can do this. We are many. We are powerful. Our stories are powerful. We can act as one, and change begins with us. We can do this. We can organize and build the coalitions and advocate for the change that needs to happen if we're prepared and we're open to the opportunities that the present has placed before us. Thank you so much for letting me do this, and thank you so much for all your work. And I'm going to hand it back to Michael.
We got a few minutes. I think we can just come off slides now and bring the screen up for anyone who would like to ask some questions or make a comment about this work. This is a lot to take in, but any questions or reflections on today's session that people would like to share? You don't have to raise your hand. You can just jump in.
Molly Musto.
So I just wanted to add, because sometimes I feel like after trainings like this, it's really hard to find anything good in anything. And great information, but as somebody who's sober, I just wanted to add that right now is probably one of the best times in history to not drink. It's becoming much more socially acceptable. There's a lot more alternatives comparatively to older generations where there was so much shame attached to having issues with alcohol. And I just wanted to add that as something that we can focus on and continue to cultivate as a culture and as individuals. So thank you guys for all of your information. Just a little addition.
Thank you, Molly.
Hola,
I just
señorita.
also wanted to, oh, sorry, go ahead.
Go ahead, Gene, you got it.
Okay. So I just wanted, first of all, say thank you so much. I always appreciate Dr. Jernigan and his information. I really, really appreciated the depth of the information, right? So often we sort of hear about the overarching alcohol policies. And so the depth of the information was really great. And I put it into the chat. I found it kind of interesting that in that early 2000s time in Atlanta, I was a college student. And so I am very familiar with the difference between Buckhead and Midtown. And so I appreciate sort of that connection for me, being able to see what I maybe experienced as a college student who didn't maybe think it was such a big deal. Now being able to look back on it and to know that that is something that's been impacted, I find to be very uplifting and exciting. So thank you for all your work. The only question I really had was, I know you had stated earlier about the CDC updating the deaths associated. I know we oftentimes really struggle to find that updated data about alcohol impact in terms of cost to society. The slide that you put up with the relationship to other crimes, I noticed that was updated. I think it was either 15 or 16. Do we know if any of those things are going to be updated by CDC anytime soon?
So CDC has a wonderful tool called Alcohol-Related Disease Impact Software, RD. And if you Google CDC and then ARDI, you will find it. That is the tool that will be updated. It's through 2019 right now, but very soon they will add 2020 and 2021. And there's several things you can do with that. It is broken down by state. This is consequences. So this is deaths. It's broken down by state, but there's also, if you hunt, you can get just the under 21s if you're working on underage drinking, and B, it will give you the attributable fractions that they're using. That's part of the tool. So it's all there, and I'm just so grateful to the folks at CDC who do the work they do.
Any other comments or questions? We have another minute or so.
People have asked about books that I recommend. I've put in Mark Schrad's book and also Alcohol, No Ordinary Commodity, which is for researchers, but it is what we consider the Bible.
It's not just for researchers, it's also for us on the ground.
Okay,
the researchers like to think it's for them. We use it.
Fine. It's an amazing summary of everything we know about alcohol policy and how to reduce this problem.
So Derek, we're going to turn it back to you now. I know you have a couple more slides to wrap it up.
Okay, there was one other question in there.
Oh, okay.
Any books or documentaries related to this topic that you may know of?
Yeah. So I'm totally biased here. The Institute of Alcohol Studies in London just put up a nice little video that they did about alcohol marketing. Yes, a lot of it is just me talking. But if you go to ias.org.uk, I think you can find it on their website. The problem with a lot of the documentaries that have been done is they've simply reinforced that myth. Every time I see another book on prohibition, it is retelling the same set of falsehoods. And what I love about Smashing the Liquor Machine is, again, this thing is so well researched, and the guy has won numerous awards for it. It is recognized as just a sterling piece of history, and it is blowing my mind.
While I have everyone here, I just want to ask, after hearing this presentation and everything that you've learned and your experiences that you have, how inspired are you to make changes in your community? What do you think about changing your community after hearing what we just talked about today? How inspired are you? You can put it in the chat, or you can open your mic and you can talk.
I think it helps for me to connect my work to a deeper level, right? To recognize that while I'm working to impact substance use prevention, including alcohol amongst youth. It helps to also see that we see the ripple effect of the negative. It's also nice to see the ripple effect of the positive.
Thanks. I pose the follow-up question in that. How likely are you that you'll be able to make changes in your community, or that you'll be able to inspire others to make changes within your community?
Okay, that's a different question, and I'm going to plead the fifth.
Anyone else? You can either put it in the chat or you can.
I think what there is to be inspired about is we see the issues and we have the tools. We know how to fix the problems that David just went through, or to improve the problems. We know how to reduce the number of outlets. We know how to reduce the amount of advertising. We know how to more equitably distribute outlets across the city. We have the tools to do that. We just need to find the fight in us to do it.
That's right.
Let me say, we are going to share the slides with you. I always say to audiences, I am slide promiscuous. Take my slides, use them, make them your own. What we want to do is to get this information out to people and back and support and inspire you to do that. I am deeply inspired. I truly believe that the arc of history bends towards justice, and that history is on our side. I look at what's happened with tobacco, and this is what I tell my students now. I mean, when I was a graduate student, half the room was smoking. And we have changed the world regarding tobacco, and I think we can do that here as well.
There's a series of questions that are coming up in the chat, and I'm sure they're being captured about where can we get certain kinds of information. Those are things I think we can look through and see if we can get resources back out to you.
Perfect. At this time, we're going to continue our group discussion with some poll questions that will follow with discussion. So we're going to start those poll questions now.
While you're doing that, I want to respond to one question in the chat, which is how can we get alcohol marketing data by state? And I got to tell you, the best alcohol marketing data to get by state is get out there and take pictures. And particular, take pictures of the ones that are near schools, that are near daycare centers, that are near whatever, that really we have to make the wallpaper visible.
It just really touched me at the point where you talked about like the redlining and how people are targeted. Because I remember in some of the work that we did in Arkansas, we had wonderful youth coalitions that designed these beautiful billboards to bring about some work in prevention within their communities. Every time they put a sign, the alcohol industry put a sign up either right before it or right after it. And it was like almost instantaneous. Within a week of them putting their billboard up, the alcohol industry went behind them and put up a billboard in order to counteract it. So our first question for you is, my coalition has actively incorporated an equity focus while working to support passage of a local alcohol, tobacco, or drug policy. And you can answer either yes or no. My coalition has actively incorporated an equity focus. As we know, and the importance about this is, as David has talked about with this, like policy itself, without an equity focus, often ends with unintended consequences. So we have to maintain an equity lens, even in our coalition work, to make sure that the policies that we push or we have our legislators to push to get passed don't have any unintended effects within our community. See, about 53% said yes, and about 47% said no. I'm going to go ahead and share those results. Is there anyone who would like to expand more on that as we have this discussion?
Yeah, I'm really interested in hearing how people have done that, because this is one of the areas that we're pushing really hard, is to take this into consideration. So any examples that folks could share about how they've incorporated this equity focus into their work, particularly I think their policy work or their sort of environmental level work. I'd be really interested in hearing some stories about that.
Let me just say that if we don't do this, the alcohol industry will take advantage of it to divide us. And they're doing this abundantly in the discussions over alcohol taxes, trying to sell the perspective that alcohol taxes are not are going to worsen inequities. You know, in fact, an alcohol tax increase will have the biggest impact on the poorest population. They're the ones who are most likely to change their behavior in response to it. They are also the ones who are most likely to get the biggest benefit. And furthermore, the funds from alcohol taxes go primarily to government services. Government services are much more likely to be used by lower income than higher income people. There are so many things that are pro-equity about raising an alcohol tax. But unfortunately, the bulk of the tax, and we've looked at this over and over again, first of all, will be paid by excessive drinkers. And second of all, in almost every state we looked at, will be paid by the highest income group. And they don't want to pay another nickel, dime, or quarter for that drink, even though it could do a huge amount of good.
Yeah, I think that issue of regressive taxation is an argument that they will throw up every time we begin to talk about doing that. And we have plenty of talking points to rebut it, but I do think it's important for us not to succumb to it.
I love what Steve put in about nothing about us without us. That's in fact what the high school students here in Massachusetts told the chair of the committee when they met with him, and that's what led to the briefing. Is they said, look, nothing about us without us. You need to hear our voices.
Well, I'll share a story about Arkansas. We had our coalitions working with the school districts, and when they had the problem with vaping, they wanted to get policies in place that would reduce vaping, but also we wanted to make sure that it was looked at equitably as well when it came to the students. So like a disproportionate number of minority students wouldn't be suspended or put out of school because of this policy. They made sure that it was put into the policies that the children that did get caught vaping, although they would have their material taken from them, they still would be allowed to stay in school. So they wouldn't get behind in school. They'd be on in-school suspension. They would still get all their work done. And most importantly, they'd be put into some classes to help them to stop vaping, to try and stop the addiction that had been caused by them utilizing that product. And that's just one example of something having a policy, having an equity focus on it as well, versus a policy where they didn't think about that at all. And before, when students were just getting suspended and put out of school and pushed farther and further down toward the pipeline to prison. Anyone else like to share before we move to the next question?
I will point out that the community I mentioned earlier in South Florida, Miami Gardens, through their work as a coalition, identified that the amount of alcohol advertising and the amount of floor space and shelf space that was dedicated to selling high content, 32-ounce, high alcohol content, low priced alcohol pops and other beverages, found that in the town next door, which had a much higher socioeconomic median income rather, had less than a third of those same product space being dedicated to the sale of those particular beverages. And they went ahead and began to work on a policy that would mandate that the coolers be locked at a certain time of the day, and that they move the ice chests, the ice bins that were single service sale of those products away from the cash register. Largely, they wanted to do more. They wanted to actually ban them, but that was preempted. And so they found a little bit of a crack in the preemption, and they moved forward with making those things happen. And it's a code violation if the ice bins are found too close to the cash register. And if those coolers aren't locked when they're supposed to be locked, they can actually get fined and eventually closed. So there are communities working on this, even in high preemption states. So that was really all about their recognition that that the low income communities of color in Miami Gardens were being targeted by the industry. I mean, they came to their own conclusion that the industry was predatory. And when they looked at it compared to other communities. So there is this, as David mentioned, this process of going out and scanning your communities using environmental scans and looking at different manifestations of the product, what's available, how much it costs, dedicated floor space in different parts of the community who have different socioeconomic indicators and different racial makeup, ethnic makeup, and seeing how it differs from other parts of the community. This is just getting our feet wet in terms of understanding how this plays out. From there, you can decide what to do about it, but first you've got to understand it.
Next question, please. Question 2 is, what % of your coalition resources are spent working with communities on policies that will benefit low-income communities of color? What % of your coalition resources are spent working with communities on policies that will benefit low-income communities of color? No judgment here, just want you to think about it. Share those results. We got okay. The answers are coming in. In the poll there, looks like we have about 48% that say only 0 to 25% of their funds are spent that way. 31% says 25 to 50%. 17% say about 50% to 75%, and 4% say 70% to 100%. I really would like to hear from one of those three that are spending 70% to 100%, and talk a little bit about how you're using it.
Yeah, what are you doing? I want to hear too.
Specifically, minority money that you're getting, or you have you are.
Yeah, because you mentioned it's on policy, so I think that's exciting. The fact that you're using that work not just for programming in specific communities, but actually working on doing policy work. So
I'm not part of those three, and I did not answer that percentage, although I wish I could have. I do work with a coalition that currently is receiving something called special populations funding through New York State. So they are being, I believe there's like 14 of them across New York State that are specifically funded to focus on very specific populations. Many of them, like for example, one of the ones that I work very closely with is focusing on Spanish speaking and Latin and Latinx populations. Another one is focusing on youth of color and impoverished and what's the other community? I can't remember off the top of my head, but those are the two that they're specifically working with. So for them, I think they would be in that 75 to 100%, which is just one of the ways some of the funding is being rolled out in New York State.
do you know if they're doing policy work with that money, or are they doing programming, or what's your sense of that?
Yeah, so one of the focuses of the grant, so it is through the Office of Addiction Supports and Services known as OASIS, which focuses mainly on environmental strategies and not programming. I will tell you, I know the one that is working with Spanish speaking populations, they have chosen to focus on their social host law that is in their county and focusing on that and the connection to alcohol, and making sure that the families are well informed of what the policy is, what it looks like, and why it's there. And then in one of the other communities, most of them are working not so much on policy development. Again, we're in New York, so preemption is huge for us. But many of them are working on either increased media around social host stuff or compliance checks.
Yeah, it's interesting. I want to
I would
Ma'am?
love to have a higher level policy being worked on in New York State. And there is some conversation of that on the state level from the coalitions as they work together as larger groups.
Mhm.
But we are so restricted in many cases about what we can and cannot work on with alcohol that it's frustrating.
I think the issue of equity, and particularly as it relates to social hosts, that was raised in Latino community in California as these social host laws were being rolled out, is that when the police respond to a home party, they end up arresting more kids of color for violations than they do actually citing the host of the party. And so when we talk about these policies doing no harm, which is a really important piece of thinking about any of the equity aspects of policy work, this is one in particular that is really important and
Well,
requires conversation.
the good and bad news is that no one has ever used our social host policy.
Yes.
So it is not being inequitably enforced. But it is definitely topic of conversation and something I'm excited to bring back to them from this conversation.
Yeah, thank you. I'm glad you're doing that, Jen.
We're going to go ahead and post the evaluation link. I see some people are having to leave, and everyone's evaluation is extremely important to us. So if you do have to go, look in the chat before you leave and complete the evaluation. We only have a couple more questions left, but I don't want anyone to get left out of our evaluation, because that's how we know how well we've done, and we also know how to make improvements in the future. So it's extremely important, as all you know is prevention, is that we get the paperwork done, and that's the evaluation. Next question. Are there parts of your community that have greater density of alcohol establishments? Whoa. Everyone has recognized it.
Tell us about those. Tell us about those neighborhoods where you have higher density. I'm really interested in knowing what that looks like.
What do they look like?
What kind of businesses are they? I mean, there's higher density like in downtown social districts and entertainment districts. There's higher density of the type of things that David was showing around the redlining, in particularly low-income communities of color. What are you all seeing? This is really interesting.
Molly says in high areas with Section 8.
Yeah.
Okay.
I was gonna say I agree with both of those things that are in the chat. We also have so in many of our urban communities, we have high density of those bodega type shops, and so not necessarily like official liquor stores. And so that is usually a very high density in those urban and especially low income populations, especially around the Spanish speaking population. The bodegas are huge, and so they're a large partner that we need to work with. And then in addition, we have a couple of communities that are really built around the craft brew world. So we've got, in where we are is the Hudson Valley, New York. So we've got a large number of craft breweries, cideries, wineries. And so the communities really build themselves around those businesses because they attract a lot of people.
Mm-hmm. Yeah, I'm
Also,
looking at the chat.
Danielle discussing Clare County, Harrison. Essentially, Harrison is the poorest of the counties. They have 90% of the alcohol retailers and tobacco retailers. Very interesting. And they focus around the college university. David, how do you feel about that? Poorest county.
Yeah, we've done a lot of work with colleges around that very issue. And one of the things that we tried to do in Maryland when I was living there was to engage the college presidents in some of these conversations.
I mean, we've also seen, even in Arkansas, they get involved with the colleges, and they end up sponsoring different teams and sponsor events, and they even weave their way sometime into the college, and they're selling alcohol on campus for different sports events. So it's very targeted.
We've had our colleges tell us that they can't deny their students who are over 21 and over the access to it. And we're like, but you also have a large percentage of your students who are under 21. And they write it off every time.
Wow. Overwhelmingly, 95%. Yes.
I want to come back to the slide that we showed and talked about what communities can do about this. Because yes, this is a phenomenon, and there will be a steady push from the industry and from the larger business community to get more and more places to sell alcohol. But there are tools available to push back. Here in Massachusetts, I just got the state to fund me because we have a very low level of state preemption, unlike New York. We have a lot of local control, but most people don't know about it. And even when there are tools, the people most likely to know about those tools are the lawyers who work for the industry. The licensing bodies quickly become captive regulatory agencies, captive of the people who stand to profit from this. And we got to push back. So the state has funded me to do a guide and to do some trainings around communities can use the existing law to influence the placement and practices of outlets in their jurisdiction.
Yes. Thank you for that work. Next question. Okay. Are there neighborhoods in your community where the off-premise outlets dedicate more floor space to high-risk alcohol beverages, like the Alka-Pops that we talked about, and the 40-ounce malt liquors, etc.? Are there neighborhoods in your community where the off-premise outlets dedicate more floor space to these high-risk alcoholic beverages? You guys are really on the ground in this fight. I see the numbers coming in overwhelmingly. Again, it's yes. You are seeing this in your community. So we hope you are empowered today with the information you get to go out and make some of those changes. We're also going to be hosting, for those who are in our region, which is Arkansas, Louisiana, Oklahoma, New Mexico, and Texas, a micro academy that's going to be coming up. So if you live in our region, feel free to reach out to me. You can come to our website and request access to that group. We're really focusing on Oklahoma though. So if you live in Oklahoma and you're doing coalition work, you're going to be high priority on our list for this micro academy that we're starting. So
We're going to teach you how to do policy.
yes.
We're going to teach you exactly how to do policy, how to win.
It's how to change some of these things from happening. Okay, here are the results. Again, overwhelmingly, 72% said yes, they are seeing this within their community. So
It'll be important to document that. I mean, if you haven't already done the scans, go out and do the scans. Let's get some data on just what that looks like. Begin to make the case, particularly if you're going to go through a policy academy, because this is the place when we're going to use that data. Take pictures. David talked about that. Let's get that data in. I really want to know, increasingly, we're spending a lot of time talking about these high-risk emerging products, the alcoholic whipped cream, all the different things, the co-branded alcoholic Mountain Dew, just what it is that we're seeing. So let's capture some of that if we can.
it was a wonderful discussion. I'm glad that you guys took part in that as well. I want to remind you again, if you have not done your feedback yet, here's our survey link. Please utilize the link or the link that's in the chat so you can complete and provide us your feedback. Your feedback is extremely valuable to us as a PTTC. And as we come to the close of today's webinar, it's been a wonderful day. Alcohol equity and social justice, breaking the silence. I want to express my heartfelt gratitude to each and every one of you that have spent time with us today. You that have been active participants or inactive or just here, everyone has provided some type of thoughtful contribution in some way. And your unwavering commitment to addressing this critical issue is heard here. in our hearts. Today, we embarked on a journey of exploration. Together, we confronted uncomfortable truths. We challenged systematic inequities, and we explored pathways toward positive change. So throughout our discussion, I remind you of how we underscored the disproportionate impact of alcohol-related harms on marginalized and vulnerable communities. And you reflected that also in our discussion. You recognize that these disparities are there. They're in your community. And we want to remind you they are not accidental. They are deeply rooted in historical injustice and systematic barriers. However, in shining a spotlight on these issues that we've done today, we have also demonstrated our collective resolve to break the silence and pave the way towards a more equitable and just society. By coming together, as we have today, and sharing our insights and our perspectives and our commitment to action, we've taken a significant step forward in our journey toward positive change. As we move forward from this webinar, let us carry the lessons learned and the connections made with us. Continue our efforts to promote equity, justice, and well-being for all. Let us be bold in our advocacy, relentless in our pursuit of social justice, and unwavering in our commitment to creating a world where everyone has the opportunity to lead healthy, fulfilling lives. I want to extend my deepest appreciation to our distinguished speakers, to our staff, and each and every one of you for your invaluable contributions to today's discussion. Your passion, expertise, and commitment have truly made this webinar a success. And together, let us continue to break the silence. Do not be silent in your community. Work toward a future where alcohol-related equity and social justice are not aspirations, but realities for all. Please visit our website at thepttc.org, join our mailing list, sign up for our newsletter, and start using the products and resources we have available for you and for your prevention efforts. The reference slides here and all the slides you've seen today will be provided to you in about 10 days. All you have to do is complete the evaluation. We'll know who you are, and we'll get these to you. Without further ado, about a minute left. Is there anyone who would like to say anything as we close?